What's going on, my support fibromyalgia friends? How is everyone doing out there? Today's date is Friday, January 7th of 2022. And I know it kind of feels like it's just been an extension of 2020 here, but it definitely hasn't been. We have some new activity coming on here, and that's why I just wanted to jump on here again. Another impromptu. More education and content coming up soon on the Support Fibromyalgia Network, so stay tuned. For everyone out there that's new, I am Melissa Tolwar. I am the Executive Director of the Support Fibromyalgia Network, and I'm also a board-certified functional medicine health coach. I'm kind of flying under the radar for this one. I decided to only do one account broadcast at this point in time so that I can try to get the information out there because I'm frustrated and I want you to be able to talk to your doctor. I am not a medical doctor. I am a board certified health coach. I wish I was a doctor because this would make things a lot easier right now, especially with the distribution of content that I'm seeing around the internet in response to COVID-19. So I thought I'd do just another video here, and I'm trying to figure out how to do it without the restrictions. I think YouTube is a little bit better, so that's why I decided to do this channel. And if you have friends out there who are on the other social media accounts, I hope that you find this helpful as we go into resources, because again, I get frustrated with the way content is being delivered, and especially the way science is being delivered and the content to our communities. So as a representative, an advocate for the chronic illness communities, fibromyalgia falls under that. And I know that fibromyalgia is getting dismissed left and right for severity of disease when it comes to COVID-19 and what you should look out for. So these are why it's important that I give you the resources so you can empower yourselves and make decisions for your own health. And that's what I'm going to do in this video to help you, but also we have friends across the board with autoimmune conditions. And as I logged in today, as I've been doing less in my Facebook account, I'm seeing more and more people coming down and getting sick with COVID in these autoimmune populations, headed to the hospital, but you are not aware of treatment protocols that have already been implemented that have some success, and then also just topics of conversation and what to ask for. So that's what reminded me to do this type of video again. We just have to keep putting that information out there. I know there's stuff in conversations about the new variant Omicron with the severity decrease. It's very, very transmissible, but I'm hoping that it is the case across the board for everyone, even if you're immune compromised, that it will be a milder case. But if anyone out there has better resources on that, I would love to know, because I've been going through the science, been going through the videos and needing more information from the United States for immune compromised patients. And I think we haven't done a good job, again, of addressing people with chronic illness conditions who are going to have a stronger inflammatory response to getting sick with the infection. And I think we dismiss this quite a bit everywhere, and it still continues to get dismissed all across the board. And I know that there's a variety of people out there who've already been infected with, and you've had fibromyalgia, you have underlying conditions, and it's come and gone. And there's other people it stayed with, and you're still getting dismissed by providers. So I feel for everybody across the board. And as someone that coaches, so I do health coach for autoimmune conditions, fibromyalgia, and I've been quietly health coaching groups with long COVID. So I have a lot of empathy across the board for what's going on. I've been involved in this from early stages and trying to understand the research, but then also helping people as I can. And again, I wish I was a doctor, as I can as a health coach, but doing these group coaching and facilitations with people that have been infected with COVID, and then seeing the ones who were diagnosed with fibromyalgia, got a COVID infection, and seeing this long-term consistent flare up, which again gets dismissed. And it's hard to differentiate between the natural flare that you might feel and what the infection brings on. So this is what the infection brings on, an inflammatory response, and things are still not getting measured with lab tests. So I would love to do more videos about the science on what to check, but unfortunately, a lot of the social media accounts flag you or all these things. So it's been a difficult run in this. I have to figure out, and maybe there's other accounts that can serve this need a little bit better. And I forgot what My boyfriend just told me the other day to check out for feed and other information that might be a bigger area, because you need the resources, right? This is not opinion. And this is why I always look for resources that, I still watch some medical providers who share their opinion and their angst about what's going on and frustration, but we're looking for the science information so that I can give you the resources you need to make an informed decision. And this is how we approach things at the Support Fibromyalgia Network, or anyway with fibromyalgia research, and giving you as much information as you can to empower you to make the choices you need to improve your health, be an advocate for yourself in the doctor's office, and whatever you need. And I've seen the confusion with the medical community, and especially with people who I care about dearly, who are lupus, in the lupus community, in the MS community. So let's get just reminders again of some of the resources to learn the terminology and the treatments that are out there. And we'll go both sides. So since I'm trained in functional medicine, so I'll bring in a little bit of that with the modern day medical treatments that are out there and the resources just to learn. If you're interested in learning, you're not aware of the terms, this will be for you. Okay, so one of the resources right here on YouTube that you don't have to travel far for is medcram. And I love this resource. I think it's very well presented without the bias and the opinions that you might see from other resources, and broken down really well. So I've been watching a lot of the videos here, and you can easily go over, and I'll provide links in the description to their video series. So they have a playlist, and I did create a Support Fibromyalgia playlist with some other videos related to coronavirus and fibromyalgia, ME/CFS, and things that I've been listening to if I find it informative, even stuff on masks, because I saw there was a big declaration, it's all over the place, regarding cloth masks. So this just understand what you need to know, because the information and the way it's being delivered is frustrating. So if you are confused, understand that a lot of people will be confused. And even when I hear people talk with the science background I have, I can understand why people are confused. So medcram has a great resource for going through the information without any politicization. So, I've been referring people to the monoclonal antibodies video that they just posted related to Omicron. Very good. Okay, so not getting paid by any of these services, walks through the science of what you need to know of the infection and what monoclonal antibodies do, and then the effectiveness that it's had on the different variants. And we also cites where these studies come from. There's also good information, I forgot to open that up too, is the Whiteboard Doctor, but I added it to our Support Fibro playlist as well, where they kind of go into these studies to talk about the incubation period of the variant and what it takes, and how they came to this average of 3-day incubation period, but it can be from anywhere from 3 to 8 days. So understanding this knowledge and getting the treatment that you can as soon as you can, and being aggressive, especially with underlying conditions, autoimmune conditions. This is why I'm sharing this information, because there is a timing to this. And especially in this video, with the monoclonal antibodies video, you want to get it as early as you can in your treatment, once you show the PCR test that you're positive, and you definitely are at risk for progression into the hospital. So learn these terminologies so you know what you can ask for, and please don't dismiss the infection for any of you. I cannot tell who is going to be at higher risk or what, but I know that there's an inflammatory response with fibromyalgia. It's getting dismissed. It's going to be frustrating. And especially if you have autoimmune conditions, or anyone in your house with autoimmune conditions, definitely get knowledgeable on the treatments. There are other videos on treatments for COVID-19 that you may want to ask your provider about. These resources are honestly becoming scarce. And the problem is it's not equally delivered into our country. So if you are in rural parts of the country, this may be much more difficult to access, just as everything normally is for you. So being aware and prepping in advance for these locations is important. So in other ways, they also have a video here on just if you do get it, how to optimize your immune system. So those are things like to definitely take a look at. And again, this is the medcram channel, which I recommend, and just being prepared. So being prepared in advance is important as much as you can. If you do get sick, definitely hoping for more of the mild case. It looks like it's more of an upper respiratory infection now, but we don't know. I mean, you're not necessarily like, oh, you have Omicron versus Delta, and what it presents and what your factors are and underlying factors. And again, with a lot of the stuff that gets dismissed in fibromyalgia, who the heck knows? So I just want you to take some caution, take some precaution, prepare in advance for what you may need. And these are tools, like when you go through the videos, you may need to add to your arsenal or your toolkit of things that you may want to ask for. You may want to write it down. You may want to talk to your doctor in advance. That could be something too, is talking to your provider in advance in the case that you do get sick. What would be the protocol to reach out to them to get the treatment that you need? And just having that conversation if you can, and then knowing the names, kind of knowing what to ask for if monoclonal antibodies are available in your area, understanding what may be effective or not, and just trying to get to the resources rather than waiting until you get sick. And this, I did a video before too on preparation, is also making sure you have some food stocked up for yourself, food in the freezer, like meals, like good quality food, nutritious food that will lower your inflammation so that you can eat if you do get sick. And you need to care for yourself. And a lot of these things too, I've been sending some Instacarts to some of my friends. You might want to look at some of those bone broths. I know Kettle and Fire, if you can have that type of thing, they have a great turmeric ginger bone broth that is shelf stable, that is ready to go. So you just can heat it up in the microwave or on the stove. It's things like that. Or sometimes there's collagen water. You can have it, it's shelf stable. You can put it in the fridge. It tastes much better cold, but you're trying to stay hydrated. You're trying to lower your inflammatory response. So maybe having some of those things available in case you do get sick. And hello. It's so good. I'll go through this content. I hope everything is good with you as well. Yes, we are here. I had to do this video because I was seeing my Facebook feed, and a lot of people in my Facebook feed who have lupus and autoimmune conditions getting sick with COVID, going to the hospital, but they were polling people in Facebook if they had heard of monoclonal antibodies. And so this is my frustration with polling people on Facebook and keeping it in there and just like the discussion. So sadly, that treatment got very politicized in the beginning, but do definitely take a look at the medcram resources and the videos on it. They go into the science. So understand the science, how it can help people with pre-existing conditions, what the creation was for it. And I wish it was much more readily available and it wasn't politicized. I don't know why we politicize treatments, but understanding what those treatments are. So this is the medical side, the standard of care of what they're doing. And again, this channel goes through the other treatments that have been coming out for SARS-CoV-2 and what you can do. And also they have the video on what you can do at home, and they list different supplements that you can recommend, and also just improving filtration, improving airflow in your house. So there's a lot of different good tips from that. And then just combining this information too with, I'd like to point out the functional medicine information. So I will include this link too. These are functional medicine resources. So I've been looking at these. I've been relying on these for the whole time period. They have very specific nutraceuticals and supplements that you can use, some recommendations. They've cited the research. They have dosages in here as well. So you can talk to your provider about them, or if you don't really have one of those providers that's kind of dismissed you, these might be supplies that you want to consider having on hand in case you do get sick. Because again, you can buy some stuff, make sure it's good quality, invest in good quality supplements at this point, have a stash for you and your family just in case. And they go through the details, especially like what type of zinc you're looking for. Have these, purchase them while you can. Vitamin D there's been different conversations on that. And I know vitamin D tends to run low in our populations. So looking at these metrics and what can best help you just get through this and being prepared. I always want people to be prepared. I'm concerned about the information that's being delivered to our communities. So that's why, again, I just had to jump on here because I'm getting more frustrated as I'm seeing more people infected and not knowing the terminology of what they should ask for or what's readily available, and feeling like they should be just dismissed, or making it, if you do have an autoimmune disease and it's just this, or getting dismissed or gaslit from your providers. It's very frustrating. So arming yourself with this information is going to be super important, and understanding maybe what dosages. And I originally, so this is the Functional Medicine Institute of Functional Medicine Research. So this is the combination of functional medicine, and then there's different information from integrative medicine, which I've followed for a long time. And this was sort of my understanding and my delivery to all my friends and family when someone got sick, was sort of this phase approach and some of the documentation evidence supporting this physiological approach, and what you're kind of looking for. And this was a document that I initially had come across when I was searching for information on integrative approaches to treatment. And these stages right here, so these foundational stages, so obviously you're doing what you can to prevent getting sick. But at this stage, as everything is becoming more transmissible, we're looking at potentially here an infection stage. So for those of us who have this inflammatory response or tend to get much more severity of disease, even living with fibromyalgia, these are the phases. And here too, it says to emphasize, like, you want to definitely decrease this escalating inflammation phase. So shifts to, you want to down regulate this potentially life-threatening inflammatory process because you don't want to end up hospitalized. So these are the different phases, and this is what the science confirms, and this has been confirmed even at ACR this year. I got a lot of literature from the American College of Rheumatology conference with people doing informational studies on people with autoimmune conditions in these phase groups. So you got to interrupt that inflammatory process, whatever you can do. Whether you're getting specific treatments from a medical professional that prescribed you those treatments, or you're doing at-home treatments, you got to lower that inflammatory response. And by doing this, you get the foundational anti-inflammatory support, antioxidant support. And this is where we're going to go through. You go through all of this data and what to emphasize during the infection. So there was a lot of research like this. In particular at ACR, it was more of the pharmacology research during these phases of what they were doing to treat patients, specifically in hospitals. So with immune compromised, how they would increase and end up in hospitals, but they were trying to create a recovery phase. So a lot of that data you'll find from ACR has some good pharmacology approaches with different steroids and those things. But I'm always looking for everything, right? You want to arm yourself with as much information as you can and stuff that you can do at home. So these are like the different things, and these are the target support systems. So again, from the functional medicine side and integrative, you'll see things again, the similar things: vitamin D, vitamin C, melatonin, because melatonin is a major antioxidant, zinc. There's information here on glutathione, which you've heard me talk about before with the process, because if you have a decrease of glutathione, you will get more inflammation running through the lungs. So this is widely known in research. We know this, and this is why originally with the alpha variant, they talked about it affecting people who are in older age ranges because they decrease their glutathione as you age. So unfortunately, you have to add in two factors like immune systems, people who have a lot of inflammation, or people even living with fibromyalgia and chronic pain. We've never done complete studies on glutathione and as it decreases, but we can make a lot of assumptions based on other studies or neurodegenerative diseases that we might need to ramp up things. So you'll see NAC, glutathione, but you can also do this with sulfur-rich foods in your diet, as the WALS protocol talks about. And this is things that I've been health coaching, the WALS protocol or the Bredesen protocol with people with long COVID, and changing the nutritional landscape to get more of these nutrients in. And in these data too, there's a lot of different herbs and supplements that they have researched to counterbalance this infection, and you hear about it all the time. So that's why you're kind of making a blend of what works for you and getting the research that you can, as much as you can, to help you and your family, whatever you need to do. And in this specific document, it goes through some of more of the science, which I can skip for this video. But it does talk about different progressions. There's a lot of good charts in here from early on. It's not peer reviewed because it's more of an integrative take. I don't think they got peer review, and I have to check for more advanced. And if anyone out there has more advanced research, particularly from more of an integrative functional approach, please let me know, because I know we have a lot of good data from other resources when it comes to pharmacology, pharmaceuticals that were given, and the treatment care for COVID-19. But you can see what we're trying to inhibit here. And this is other variants. So now that with the new variant, we're looking at more of the bronchial infection as opposed to some of the, so upper respiratory as opposed to lower respiratory. But still, like, we got to get more data on immune compromise. So that's why I'm just sharing as much as I can. Please do ask questions, share research. There's a very smart public out there. All of you are brilliant when it comes to the science. So share as much as you can with people so that they can feel prepared. I always assume that people know this information, but as I'm talking to people in the autoimmune community and as they get infected, I'm noticing that the information has not traveled to them. Here's another resource from Alyssa Song. So it was a pediatric resource because people have been asking me about dosings for kids. So I just try to send them this resource, try to look it up, ask your provider. So these are breakdowns of what she went through, because I believe one of her youngest kids did get sick early on. So this is from the alpha type variant, even before Delta. So this is 2022, but she does give some dosaging for the different supplements that you might consider looking at and talking to your provider about, but it goes into that. So that's why I thought that these resources would just be an important reminder for people out there. And to get that going, let me just check in with the comments because I had my screen shared. So you are familiar. I'm glad that you're familiar. I'm glad there are people familiar, but it became way too politicized, especially in Florida. But I'm glad because Florida stayed strong with its approach. And I think the hard part is that people immune compromised, people tend towards progression of disease, or if you get strong responses to flus and colds. Like, these treatments were really meant for you to get early on. So it was so sad that it got politicized, but I'm glad that you're staying safe and then supplementing. Good. So I think this is all, we're just trying to get this information out there, because I'm still seeing people ask those questions on social media. And I was disheartened to see people I know and I care about not be familiar with these treatments. That's why I just hurry and just give them the information. But in other accounts like Facebook, I got blocked. I was put in Facebook jail for sending people that functional medicine link. So it's difficult. It is really difficult to get people the information that they need. But we're going to do our best here, and we're all sticking together. We're fighting for each other to get the correct information to help our communities. And if you are getting dismissed by your provider and told, just don't worry about it, you only have fibro, just use these tools of information. There's other YouTube accounts that I like to watch, like John Campbell in the UK. He gives really good information. Mike Hansen. So I've talked about their YouTube channels before. And what I'm looking for is they're presenting the information calmly without as much bias as they can. I mean, we all insert some form of bias in our thinking, but not having these political ties. Because you noticed, like, on all the news shows, it's frustrating because we have to look out for each other. I want chronic illness patients to be considered more in the conversations, especially with guidance and what we need to know. And right now it is so confusing. So I wanted to do this video for you a little bit under the radar. Thank you, everyone. I'll have more structured education coming forward. I'm really excited about doing a WALS protocol video, more nutrition videos. and even some therapeutic movement as I become more interested in how to move my body without crashing. So I've moved over to the other side, right? I've been very adverse to that word exercise, but I have some new tips that even I've discovered and been open-minded to that it's actually helped. So moving my body without the crashes. So I think we can finally get to that point where we move to a point where we can have therapeutic movement consistently without crashing our bodies. And I'll stay tuned for that. But thank you everyone for tuning in. Please just definitely look up the content, follow those videos, learn some of the science and the terminology so you can be better prepared to talk to your providers. Or if you need to get those resources, just have them on hand just in case. Is just preparing for any like type with just having that preparation is important. So thanks again, and I will talk to you later. Bye.